I'm Ralph Hise. I've served in the state senate now for 8 years. Grew up in a small town in western North Carolina called Spruce Pine. Was born there, went to school there. My first job was working for a department store called Rose's. Started there and was making at the time $3.85 an hour and stocked shelves. It feels a whole lot different even when you're out with your friends when you're having to reach in the wallet for the money you earned versus what someone else gave you.
So Senator Hise has been a champion on everything health and welfare reform related in North Carolina. He has been at the forefront of all of the Medicaid reform talks in North Carolina, saving billions of dollars, but also helping the truly needy. You think about healthcare reform and dollars saved, but no one talks about the lives impacted. And I think for Senator Hise, both are very important to him.
Christy Herrera has probably been the one who does most of the making sure we have the information, making sure we've put together a plan to deal with, as any legislature will tell you, it's always the other chamber that's the problem. So making sure that when we try to move things in the Senate, that someone's out there coordinating the House and not making that common mistake we make of just doing the right thing in one chamber. When we tried to run out the first time that we were going to cut back some of the requirements and replace the asset test back on individuals, I mean, we were literally, we're destroying the children, we're destroying how many people we're pulling off a free or reduced lunch and those kind of things. And you really saw just how much of a measure of success the program has of the number of people enrolled, not how many people come off the program and are able to sustain themselves. We're already at 1 out of every 5 people in the state is covered by Medicaid insurance. When you look at births in this state, we're approaching 60% of the births that occur in North Carolina are now covered by the Medicaid system.
There were cartoons, political cartoons made of Senator Hise, snatching lunch trays away from little kids. And this was all absolutely fabricated. But, one of the things that my dad always taught me growing up is if you're not taking flack, you're not over the target. So Senator Hise has been over the target, and I think a lot of those criticisms are really badges of honor.
I guess the biggest shock for me all is just how pervasive the system was and how far we'd gone beyond helping those in times of need to becoming that dependence program. I think that it's very important for individuals to have a sense of pride and accomplishment in themselves. We want to create a welfare or Medicaid or food stamp system and others that helps people in times of need, but doesn't create a dependence on another government system.
A lot of times legislators who become thought leaders are kind of thrown into that scenario and they thrive. And what I've seen over the past years is that Senator Hise has really thrived as the thought leader for health and welfare in North Carolina. So it's been so fun to see kind of his trajectory as he's accomplished greater and greater things.
Growing up in Spruce Pine, which is part of the Southern Appalachians, and our heritage and others, we have a fierce independence. Western North Carolina is really built on self-reliance. And I struggle with seeing how that's changing right now and how that people look to government for their solutions. We know that individuals have the solution in them.